Hello and welcome. Today we're diving deep into a significant health concern linked to the urinary system leptospirosis-associated nephropathy. This serious kidney complication arises from a bacterial infection and can have lasting consequences if not promptly addressed. Let's explore the intricacies of this disease and understand how we can protect ourselves. Leptospirosis-associated nephropathy, as the name suggests, is triggered by Leptospira bacteria. These bacteria are zoonotic, meaning they primarily reside in animals. Rats, cattle, pigs, dogs, and even wild animals like raccoons and rodents can carry Leptospira. Humans contract the infection through contact with contaminated water or soil. This occurs when urine from infected animals mixes with water sources or soil, and the bacteria enter the body through broken skin, mucous membranes, or even by swallowing contaminated water. Certain occupations, like farmers, veterinarians, sewer workers, and those involved in outdoor recreational activities, are at a higher risk of exposure. Now let's unravel the complexities of how leptospirosis leads to kidney damage. Once Leptospira enters the body, it rapidly spreads through the bloodstream. The bacteria can directly invade and damage the renal tubules, which are vital components of the kidneys responsible for filtering waste and regulating fluid balance. Additionally, the body's immune response plays a crucial role. As the immune system attempts to combat the infection, it releases inflammatory mediators that can further injure the kidneys. This combination of direct bacterial damage and immune-mediated inflammation disrupts kidney function, leading to the symptoms we'll discuss later. In severe cases, it can progress to acute kidney injury or even renal failure. Leptospirosis is a global disease, but its prevalence varies significantly depending on geographic location and environmental conditions. Tropical and subtropical regions with high rainfall and poor sanitation tend to have a higher incidence. Factors like flooding, inadequate waste disposal, and close proximity to livestock can increase the risk of transmission. Outbreaks often occur after heavy rainfall or natural disasters. While the exact numbers can fluctuate, it's estimated that hundreds of thousands of cases of leptospirosis occur worldwide each year, with a significant percentage leading to nephropathy. The signs and symptoms of leptospirosis-associated nephropathy can vary in severity. In the early stages, individuals may experience flu-like symptoms such as fever, headache, muscle aches, particularly in the calves, and chills. As the disease progresses and affects the kidneys, symptoms related to kidney dysfunction may appear. These can include decreased urine output, swelling in the legs and feet and edema, fatigue, nausea, vomiting, and even jaundice, a yellowing of the skin and eyes. It's important to note that some individuals may experience mild or no symptoms at all, making early diagnosis challenging. Diagnosing leptospirosis-associated nephropathy requires a combination of clinical evaluation and laboratory testing. A doctor will assess the patient's symptoms, medical history, and potential exposure to Leptospira. Blood tests can detect the presence of Leptospira antibodies, which are produced by the body in response to the infection. Urine tests can reveal abnormalities such as protein or blood in the urine. In some cases, more specialized tests like PCR polymerase chain reaction may be used to directly detect leptospirine in blood or urine samples. Renal function tests, such as measuring creatinine and BUN levels, are essential to assess the extent of kidney damage. While there aren't distinct types or classifications of leptospirosis-associated nephropathy in the traditional sense, the severity of kidney involvement can vary. Cases can range from mild, transient kidney dysfunction to severe acute kidney injury requiring dialysis. The severity often depends on factors such as the strain of Leptospira involved, the individual's overall health, and the timeliness of treatment. The primary goal of treatment for leptospirosis-associated nephropathy is to eradicate the Leptospira infection and support kidney function. Antibiotics such as doxycycline or penicillin are typically administered to kill the bacteria. Supportive care is crucial to manage the symptoms of kidney dysfunction. This may include intravenous fluids to maintain hydration, medications to control blood pressure, and in severe cases, dialysis to filter waste products from the blood when the kidneys are unable to do so. Early diagnosis and prompt treatment are essential to prevent long-term kidney damage. Prevention is key to minimizing the risk of leptospirosis-associated nephropathy. Avoiding contact with potentially contaminated water and soil is paramount. Wear protective clothing such as boots and gloves when working or recreating in areas where exposure is likely. Wash your hands thoroughly after any potential contact with contaminated water or soil. Control rodent populations around your home and workplace. Vaccinating animals, especially dogs and livestock, can help reduce the spread of Leptospira. Ensure proper sanitation and waste disposal to prevent contamination of water sources. The prognosis for leptospirosis-associated nephropathy depends on the severity of the kidney injury and the promptness of treatment. With early diagnosis and appropriate management, many individuals recover or fully experience only mild, residual kidney damage. However, severe cases can lead to chronic kidney disease or even death. Recent research is focused on developing more effective diagnostic tools and treatment strategies for leptospirosis, including exploring novel antibiotic therapies and strategies to modulate the immune response. Further research is also underway to develop improved vaccines for both humans and animals. Understanding and addressing the complexities of leptospirosis-associated nephropathy remains a crucial area of ongoing investigation.